everyone, welcome once again to another interesting episode on Health Talk with Fifi. With me, Ajwa Duma Ansan. Thank you so much for your help so far. We want you to know that we read your comments and make sure you keep them coming. Continue liking, commenting, and sharing our videos. Most importantly, subscribe to our YouTube channel. Follow us on social media at Health Talk with Fifi and on YouTube at Health Talk with Fifi. Let's look at how you will care for a wound. Imagine your kid, your student, your niece, or anybody gets a wound. How are you going to care for it in the house or at home? Before we do it, or before we get into this video, let's take a look at what we did the last time and we'll be right back. Now let's look at why and the need to drink water. Importance of drinking water. 1. Maintains body function or the bodily functions. Water supporting digestion, regulating of temperature. It helps in the cells, the tissue, the organs, the system, in fact the whole body, the whole system in the body. Water helps in each and every activity that goes on. All the physiological functions in the body, water helps in achieving or attaining them each day and night. So one has to drink water every day, every time. In fact, enough water. People drink water as they take in wine. They sip. When you give them a glass of water, they can use an hour to sip a glass of water, which is a very bad behavior or habit. So caring for a wound properly will support its healing process. So when you have a wound and you take very good care of it, you could realize that the wound heals faster. Today we are looking at how to care for a wound. Your child, your student, or anybody can have a wound at any time. And how do you care for it if the person hasn't been taken to the hospital or you are in the house? How do you care for a wound? Let's take a look at the process involved in caring for a wound. First and foremost, before you touch somebody's wound or before you attempt to dress a wound, make sure your hands are clean. Have a clean hands. Wash your hands thoroughly with soap and water before you get into contact with somebody's wound, in order not to introduce any bacteria or any antimicrobial agent to the wound, which will cause the wound to be infected and delay its healing process. Second of all, you gather all your equipment: gauze, bandage, water for the cleaning, plaster, any other thing that you will need to dress a wound or to care for a wound. Make sure you gather them after washing your hands, in order not to contaminate the material or the equipment you are going to use for the caring. Please make sure you wash your hands first, then you gather your equipment. Now after gathering all your equipment, check if the wound is bleeding. If it is bleeding, make sure you stop the bleeding. You apply a bandage, a sterile bandage, and you press it, you gentle press it on the wound to stop the bleeding. So that is the third thing you do. You stop the bleeding if the wound is bleeding. Now you clean the wound with clean water, or clean water with mild soap. If there is no mild soap, you can put salt in water, then you not too concentrated, then you use the solution to clean the wound. So you clean. The fourth thing is you clean the wound. Second of all, you can apply any antiseptic, which is optional. So you apply any antiseptic or any other wound healing ointment or liquid onto it. Then you cover the wound. After that, you cover the wound. Make sure you are keeping the wound dry. Keep it dry and watch out for signs of infection, whether there is discharge coming out, whether the wound keeps on wetting or water coming out from it. Make sure you are monitoring all those things. Whether there are exudates coming out from the wound, make sure you monitor all these things. So after covering the wound, watch out for infection And also give the person a pain relief if the person is going through pains after dressing or during dressing. So when the person is going through pains after or during the dressing, right after dressing, give the person a pain relief drug or medication to ease the pain. Seek medical attention for deeper wounds. Let's say a surgical wound, and after undergoing a surgery, any wound that can, make sure you seek a medical attention for such wound, for a proper care, not to infect the site, the wound site, for healing process to take place. So make sure you seek medical attention. But if you are home and your child has a minor wound on the leg or on the arm and you want to treat it, make sure you follow all these procedures. Make sure your hands are clean before you touch the wound. You gather all your equipment. You don't bring the person, then go and bring bandage. Hey, then go and gather all your supplies or your equipment you are going to use for the wound caring or the dressing. That is after washing your hands. Then you control the bleeding. If the wound is bleeding, you make sure you control the bleeding. You apply antiseptic to it. That is, if you have, you cover the wound and you make sure it is dry. Then you monitor any signs of infection, whether there is water coming out, any discharge or exudate coming out from the wound. I hope you enjoyed today's video, and from now on you will know how to care for a wound in your various homes, offices, and in schools. Thank you so much for staying with us on today's episode on Health Talk with Fifi. We'll be right back with more videos. Bye.